All right. Hi, everybody. My name is Catherine Nodert. I'm the Senior Director of Community Engagement at the ALS Association of Texas. Welcome. Thank you for joining us. Today, we have Karen Martin presenting Optimizing Nutrition in ALS, and she is a nutrition support dietitian in San Antonio. So really excited to have her speak to us today. Before we get started, though, we're going to go through a few housekeeping items. First of all, if you are joining us from a desktop device, you will want to have your presentation in active speaker mode. So you'll see 3 or 4 boxes on the right side of your screen. When you roll your cursor over those boxes, you'll see a dash, a single box, 2 boxes, and a grid. You're going to want to click the single box. That's going to be the best view for you so you can see everything on the slide and the presenter at the same time. If you're joining from a mobile device, from a phone, from a tablet, this should already be default, so you don't have to do anything extra. We are recording this presentation, and we will send the recording out to everyone who's registered for this webinar afterwards. You can always access all of our recordings after the fact on our website at alstexas.org/virtual events. We are going to keep everybody on mute for the duration of this presentation, but if you have any questions during the presentation or at the end, please feel free to put them in the chat box, which can be found on the bottom or the top of your screen. I'm going to put a little note in here so you know where it is. There you go. So you can find your chat box. Please feel free to ask questions there at any time, and we will ask those of Karen throughout the presentation so she can answer them. And I believe that's it. So without further ado, please welcome Karen Martin presenting Optimizing Nutrition in ALS. Karen?
Thank you so much. I actually presented something similar to this a few years ago, and I went back to listen to it, and I could not, the volume was so bad. So Steve with the ALS Association has loaned me one of the headsets that are used for voice banking, so thanks for that. So did want to talk about optimizing nutrition in ALS. There are so many things that can impact the status of our pals, and we want to delve into that further. I've been a dietitian for 35 years, so a long time, and I really love what I do, and I particularly love working with my neuromuscular patients. So I've been with the ALS group and the clinic at UT Health for 16 years, and I also am the administrator for the ALS dietitians listserv. So if you have a dietitian that may not be part of that, they can contact me and I can get them into that group where we can share information among dietitians. And just as a disclosure, I'm also employed with Emerita Specialty Infusion. So we'll be looking at factors that impact the energy balance for patients with ALS. It's quite a balancing act. I meant to go in and put like a tightrope or a balance type scale in my slide sets, but we'll be looking at the things that cause you to need more calories and the things that might make it harder. We'll be looking at strategies to meet these very high demands for calories when the intake might be compromised, but yet the need for calories is increased beyond what it would normally be. We'll look at the options for tube feedings and what other things might come with that same type of therapy that may be of benefit. And then we'll be talking about some trends in more food-based formulas, as well as what's new coming up down the pike with enteral nutrition in general. So on the side of the balance scale that cause you to need more calories, of course, we have respiratory changes. As your pulmonary function tests, as your forced vital capacity declines, the work of breathing increases. All of that is a metabolic driver. It puts you in overdrive for needing more calories. When it's hard to breathe, it makes your metabolism soar. And then many of our pals have fasciculations, those little small nerve twitches that sometimes you can just look and see them in arms, in legs, We hear them reported to the trunk, sometimes to the tongue as well. Those also, if you're laying in your recliner, these fasciculations that sometimes don't stop, that drives your calorie demand. So it causes you to need more calories for that as well. And then just the work of getting up out of the bed, putting on your clothes, and doing your activities of daily living, all of those things require more effort as well. So just the routine things that you're coming across, those are all causing you to need more calories. And on the other side, we have, at the same time, we have challenges with chewing and swallowing. We may have longer meal times, so you're working at eating longer, and it could be because it's hard, getting your food to the mouth is the problem. Even if the chewing is not compromised, the hand to mouth and the holding of your drinks and those kinds of things may be a challenge as well. We also can't ignore the fact that depression can limit calorie intake. And we also hear, I didn't put it in here, but we hear patients saying that they just don't really have an appetite. So maybe food doesn't appeal to them, or their taste is changing from what they normally like. I do know that a little bit more frequent utilization of medical cannabis is being offered. So it might be that you might benefit from a case of the munchies, and that might help your appetite in some cases. Then also, when you are constipated, it makes you not hungry. So if you haven't had a stool for 4 days, then you are probably not looking to get more food intake going. So those are things that make it where, I'm not really hungry. So some of the things that we do as far as interventions for nutrition interventions to combat these types of things is we look at, in concert with our speech pathologist, at modifying textures and of course eliminating those offenders. If the crunchy chips are the problem, or salads, a lot of times lettuce is a problem. Going for softer, more moist foods, things that are crock potted and have more moisture, stewed chicken, flaky fish, those kinds of things, not like a dry piece of meat. A chicken fried steak or something like that would need lots of gravy with it. So you can still have those things if they're in your realm and are not a problem for you, but we need to moisten them up with lots of gravy. And then looking at the textures to be modified as you need it. So just, as you're finding that you're having trouble manipulating food in your mouth, it may be a better idea to go ahead and have more moist, prepared, softer foods, and even blending or chopping in advance, because that also, if you're having struggles with limb weakness and you're spending a lot of time with the cutting of the food and the pre setup for the meal setup, that can also be something that we want to look at to see if you can have those things done for you. We also talk about caloric enhancements. If you're part of the clinic in San Antonio, you probably hear my spiel for how to add more calories per bite. And a lot of these things can just affect the pal and not the family members. So these are things that can just be added individually, so you don't maybe have to cook differently for the entire family, but have a cruet of olive oil on the table. Lots of different flavors. Lemon is one of my favorites, and you can drizzle it on meats, vegetables, pasta, rice, anything that you're eating. It's heart healthy. Again, the flavors are awesome. It tastes nutty, and it gives you 45 calories per teaspoon without you having to actually eat more food. Coconut oil is also in vogue right now, and I like that it's not part of a multi-level marketing scheme. Nobody's getting, a lot of funding off of it, so it's something you can also add to your diet. I like it on sweet potatoes with some brown sugar. It's kind of has a tropical taste, and I like that. Avocados, guacamole. You can spread guacamole or pesto sauces on sandwiches, and then avocado slices on anything that you would enjoy that in. Shakes, all kinds of different shakes. The cream sauces, cream-based soups would be good choices. I also have some suggestions for some things that are pre-made that you can get. I think I have those on some slides later, but things that you can purchase that are ready made. And for those of you all that are in the areas that have like the HEB Meal Simples, a lot of our patients that don't have the food preparation ability are enjoying some of those kinds of meals, or mom's meals, those kinds of things that they're ordering in. Cheeses, cream cheese melts easily into a lot of things, and can also give a really good texture. If you put cream cheese and butter in mashed potatoes, then it tends to keep it from having that very glue-like texture the next day, so you can reheat them and it's moist and creamier. And the cheese, again, is a good idea. We want to avoid extended meal times, which lead to more fatigue. If you're in the gym and you're working your bicep for half an hour, that's too much. It's going to fatigue. So if you're working at eating for an hour, that's a long time. So smaller, more frequent meals, and then also looking at those shakes and incorporating some supplements are a good idea. So another thing, it's often advantageous to take medications in a vehicle that makes it not run down so fast. A lot of times we have trouble with the meds. If you try incorporating them in pudding, applesauce, or yogurt, it's easier to, it kind of slicks it up, but it also doesn't run down so fast that you choke on it. So the water and that the meds are kind of that mixed texture type thing. Like watermelon, you're thinking solid, but then the juice runs down your throat really fast. So fruit cocktails, some of those kinds of things. So if you can have them with some of those types of products, then you might have better access to your medications. Another thing I really like to talk about is hydration. We do know that our pals report to us that they're not really having as much fluid as they should because they don't want to have to toilet. So definitely the mobility challenges are limiting the toileting independence. Some of our pals are at home by themselves for periods of the day and may not have assistance to get to the toilet. So they're like, I restrict meals, I restrict my fluid until these times of day. So to decrease that need for assistance. But the part of hydration that is so important, it has manifold impact on a lot of areas of ALS. If you think about your secretions, if you have good fluid intake, then your secretions can be have more lubricity, and you're going to be able to cough them up more readily than if they're sticky, gummy secretions that you just can't get up. So that's going to help with your if you're needing to suction out, but you might be able to cough something out more readily if you would amp up your hydration. So poor hydration compounds the problems with the saliva, as well as clearing of medication, keeping your kidneys functioning and free of urinary tract infections, and keeping the liver in good shape. And then also definitely a big factor for constipation. Even if you are taking a laxative, if you think about mixing up Metamucil and not putting quite enough water, if you were to come back in half an hour, you could set a fence post in the product because it's just going to be hard. The same thing in the bowel. Even if you are on a regimen and you're trying to get all this fiber in, fiber works with fluids. So anyway, just make sure you know what kinds of things that you're eating and drinking that contribute to your fluids. I generally count about half of the caffeinated products as the volume towards your fluid intake, because they are a diuretic, so they're not really giving you the full I just had a bottle of water kind of benefit. And another thing is we'll talk a little bit later too about other things that contribute to your fluid intake that we can incorporate. And then also just some ways to monitor urine output for adequacy, making sure that it's dilute and it doesn't smell strong or look like tea or Mountain Dew, unless you've just had, if you've just had meals, if you've just had vitamins or meds, it's going to look more concentrated. But just during the day, aim to have it more dilute and not strong smelling. We also have something that a lot of our male patients enjoy using, the condom catheters, that if you want to speak with your occupational therapist about that, that may be something that would be beneficial for you. For people that are traveling, back in the day when we were flying, rather than having to go to an airplane toilet, if you have a condom catheter on, you're good to go. And they provide both a leg bag and a bed bag for overnight. So anyway, the fluid restriction related to the lack of mobility does increase the likelihood of the constipation. So, but if we think about bowel movements, they involve more muscular work than we think about, that we consciously don't think about the legs in place and then the push and all of those kinds of things that may be in decline for our pals. So at the certain point that you have let the urge go, if you don't respond when you have the urge, if you don't have someone there to assist you at that time, then that urge is going to go away and not come back for 12 hours, which at that point you may be in the bed and you don't want to wake up your partner to help get you to the toilet. So at that point, the fluid is further absorbed and the rectal vault gets dry and the constipation is compounding itself. So, so we want to look at the things that help early in the disease. Fiber is a good thing, but I do think that in an immobile patient, many times we've seen a lot of fiber as not an excellent thing for a patient that's not mobile. So as the bowel regimen and the need for more softeners and osmotic agents such as Miralax, lactulose, those kinds of things, as that increases, then maybe switching to a lower fiber regimen is a good idea. And then I always say in my little constipation spiel that a glycerin suppository, if you have missed an opportunity to go, is a good idea. And try instilling it for 15 minutes at least, maybe while laying down, and then get up and sit directly on the toilet, so that can give you a good chance of being able to go without a stimulant or any kind of more aggressive management. So there's other things out there, the Miralax, it's called polyethylene glycol 3350. Lubiprostone is another product, Amitiza. And then sometimes I recommend the sugar-free chocolates or candies that you see. You'll see that they have a warning on, I'm kind of a Jelly Belly fan, but there's a warning on the sugar-free Jelly Bellies that excess consumption may have a laxative effect, and that is no joke. So if you like chocolates that are sugar-free and have the sugar alcohols in there, be careful with the amount you have, because if you have a mobility challenge, you also don't want to have like liquid diarrhea. But if you have just a few, and see if 5 jelly beans or a little square of chocolate might help you out, then anyway, it's kind of fun to be recommending that as a dietitian. So also think about not sitting on the toilet for long periods. Kind of help yourself be ready to go when you're there, because if you are taking, the newspaper or War and Peace into the bathroom, then you're going to end up with hemorrhoids. So try to go when you're ready, and be efficient there. And then also think about how dilute your urine is, if you can see through it, if it were in a glass. And then maybe think about accepting a new normal. It is not constipation if you go every 3 days and it's not with difficulty. Constipation is the guy on the right with difficulty and sweating, and he's obviously not in a comfortable spot.
Karen, I have a quick question
Yes.
for you. Linda asks, does the chocolate or jelly beans have to be sugar-free?
Yes, that's what has the sugar alcohols that has a laxative effect. Yes, that's the reason that's effective. These are other places to get fluids. So your canned and fresh fruits and vegetables are almost 100% water. So if you can think about even getting canned apricots and pureeing those and having them like that, or just if you're able to eat canned fruits or fresh fruits, those are good things to incorporate if you're not drinking applesauce. Even if you aren't able to drink water as easily, water, again, that really fast rush is one of the hardest things to get in. But these are other places to get your fluids, from fruit nectars, like an apricot nectar, smoothies, cream soups, V8 juice, tomato juices. Again, those are salty, so they may not quench your thirst and make you feel as satisfied. The drinkable yogurts are a good idea, and I like to recommend the whole milk yogurts, and they used to all be for infants, but now there's a lot of whole milk yogurts out there. So if you look around, you'll see, I believe Siggy's has one. There's different brands that you'll find in the stores, but it used to just be the Yo Baby Stonyfield, but you'll see those out there. And of course, Odwalla is going off the market. I just heard that the company that owns that has pulled that line, but you'll find the Bold House and some of those kinds of drinks that are thicker, the carrot juice, and that product tastes really fresh and good. Don't be afraid of the green juices that are out there, because the first ingredient is usually apple juice, and so they don't taste like anything that you should be so afraid of. You can also freeze those purees in ice cube trays and pop them out to use when you want to. And that's one of my favorite pieces I have up there, the little La Madeleine tomato basil soup. The first ingredient is heavy cream, so I can really only incorporate it in my diet when I'm doing something very active, but that's a good thing to include, easy, ready to go for our pals that you might enjoy that product, including that. Some adaptive equipment that you might ask for that might help you with your fluid intake, especially if you are having someone else to help you with your drinking. You know how much you can swallow comfortably, but if someone else is holding the drink up and the fluid is going in, you're not really in control. So if you are having struggles with that, here's a couple of things that might work for you. You see on the left the Proval cup, and this cup provides a metered amount of 1 teaspoon or 2 teaspoons at a time, whether the 5 or the 10 cc, and once you turn it back down, it'll reload your volume. So it's a volume control. So for those of you that you want to drink water and you can handle 5 cc's, but not just open, turned up, free flowing where it's running all out and you're choking. So anyway, that may be something that might be helpful for you. The other thing in patients, particularly with not just the muscular compromise, but the respiratory compromise, where using a straw, if you might like to use a straw, but drawing the liquid up through that straw column takes half of your breath. This product, the Sip Tip cup, and straw. You actually can press on the top of the lid, and that straw has, you can see the piece there, that little piece that goes up inside there will cause the liquid to stay primed. So so this makes it nice because you're not having to use all of your respiratory volume to draw up and have nothing for the column of the straw. So that's something else that you might ask about, that you can find those if that's something that would be useful for you. Some other things that we have here. Another thing that we find, a lot of patients have trouble with liquids because they're going for the last sip out of the cup. So a patient with respiratory compromise does not need to lean back and go for that last sip of out of the cup. But what you can do is get what's called through the is it Preston Samon's catalog, the ones the OTs have, they have a cup that's called a Nosy Cup, and you can get that, and if it works like that dual cup, that's a little paper cup, but it's got that cutout right there, so it gives you a place to put your nose, so you don't have to lean back to finish what's in your cup. So that's something that you might think about. Or you could just get a styrofoam cup and cut out a place for your nose on the back side of the cup. So just something to think about, because I'm always very interested in my pals getting plenty of fluids. So that's something I talk about too. Again, here's the information on the condom catheters. They're great for saving energy, not having to get up out of bed in the middle of the night several times. They're great for travel savers. You can use urinals. Some of our veterans have been getting bidets, and there are some conversion bidets that you can get that can go on a regular toilet. So if that's something that would help you with your toileting, then it's something you might want to check into that. Here's some of the things we already talked about, those calorie boosters, the olive oil, cream cheese. Whipping cream is a great thing. How about some malted milk? If you're making a shake, malted malt has a lot of calories. I used to order, back when I was in high school, butterscotch malt with double malt, and it was very good, but very high calorie. But some of the things, again, that nut butters, if you add that to shakes, a lot of times things like peanut butter, almond butter, cashew butter, those things may be, they're likely a choking hazard for you. But if you put them into a shake, then that's something that could be beneficial for you. And then those other things that we already talked about. So I kind of wanted to go now a little bit into some of the nutrition recommendations from the Academy of Neurology. We do look at the evidence base for the things that we recommend, and there are some pretty strong recommendations for PEG. So in patients with ALS with impaired oral food intake, a PEG should be considered to stabilize weight. I always tell my pals that this doesn't mean that you cannot eat the foods that you want. It means that you don't have to eat everything to feel like you're not going to lose more weight. So you can eat the things that you want and then use the tube for after that. So again, the recommendations note that it's probably safer to get a feeding tube placed when the forced vital capacity is higher. So consider that. And then the other thing that the practice parameters looked at were nutritional supplements, and some of these things were studied in our clinics in Texas, but there was not good evidence that creatine should be used. That was one of the ones that they did not recommend. And then vitamin E, high dose should not be considered, and there was not a recommendation about low dose. Do I get more benefit from being seen in an ALS Center of Excellence, affiliated, an ALS Association affiliated clinic. Does that help my outcomes? Well, it does seem like that patients that are receiving care by a multidisciplinary team, they seem to have access to more types of therapies that can prolong survival and enhance quality of life. So that may be something that you should consider if you are not with an affiliated clinic. Some of the things that they looked at for what do we need to know more about, looking at the indications for adequacy specifically, and when is the optimal time to get it placed, and then more studies on novel antioxidants and supplements. And I know we always recommend to our pals that they check out the ALS Untangled website to look at things if you're wondering whether something is maybe a fringe therapy or whether there's evidence behind it. That's something where they go in and they look at the evidence and they share it there in a way that's scientifically appropriate. One of the things that we are using in the clinic for some time now to look at how much your swallow is impacting your quality of life is this Eat 10 assessment. And so you may be familiar with these questions that we're asking you as far as how your swallowing has impacted your weight, going out for meals other than COVID causing us to not go out for meals, right? Our swallowing of liquids, taking extra effort, solids, and pills. Generally, it's not painful. That's for other types of diagnoses, and this is a standardized screen. But is the pleasure of eating affected by my swallowing? Sometimes our pals are not really enjoying eating that much, but their caregivers and family enjoy them eating. And so it's just kind of a realization of, yeah, it's, looking at the score here and what he or she is saying, they may, it may be too scary for them to be thinking they're going to choke on every bite. So, it looks like they do want to proceed with the feeding tube. So just some things to think about. If swallowing causes food to stick in your throat, it causes you to cough, it's stressful, and so forth. So those are some of the things that we may be asking you to respond, whether there's 0, no problem, to 4 being a severe problem. And it kind of lets us know, oh, where are we in the discussion of how much this is impacting your quality of life. These are some of the ways that we look at intervening nutrition wise. So I'll just leave that out there for you to look at later. I did have one of my patients came back to clinic, and she was like, I just need to tell you, I'm just so happy with my new friend Peggy. She helps me to be able to go out and do the things that I want to do, and improves her, it improved her quality of life. So if you're considering getting a feeding tube, there's a video on the decision making that we can provide a link to. And you'll have home health that will be arranged to help you with the use and care and the healing of the tube site. It's important to clean it daily, and not to overly clean it, but clean it daily with soap and water. Don't scrub it down with a brush or anything. In South Texas, I also think it's important to get away from gauze early. Sometimes people are like, putting like a loaf of gauze in between. And in South Texas with the heat, it generally is not as good an idea to have a lot of gauze packed up under there. So get away from the gauze as soon as the tube site is not getting your clothes messed up. But use it for sure for your medications, for your fluid intake, and your nutrition, just as either as your meal replacements or as an adjunct to what you're enjoying. If you are enjoying your food, I want you to enjoy your food. It's an important thing. And as a dietitian, I love for people to enjoy food, but I just want you to do it with the least amount of risk. So if you do end up with a feeding tube, this is generally what you would be on something, and I hate to use brand names, but I kind of think it's like an Ensure Plus with fiber, just because that's something you're familiar with. And a lot of pals may say, oh, but I have diabetes. Well, the fiber in it is so significant that it can be appropriate even for someone with diabetes, just because, like, one way to help control diabetes is to take some soluble fiber with your meals. Something like Benefiber or Metamucil with meals will help slow the rise in blood glucose. And we generally give a range because we want it to be based on how much you are still continuing to eat, how your function is, or your respiratory status. Some patients may eat for 5 minutes or 10 minutes and then take their tube feedings. And then we generally like for just more physiologic, I like for our families to use the gravity bag delivery system as their first choice, rather than just pouring the formula in, because we don't eat our meals in 5 minutes. And if you do it with the gravity bag and there's like a flow clamp on there, that you can slow down the infusion to make it last the length of a meal. You flush it with water before, you let it go in over 20 minutes while you're watching TV, reading a book or whatever. And then once you're through, you disconnect, you flush the tube, and you go about your day. So I like to use the gravity bag system as the first choice for our families. Looking at funding for the tube feedings, many of our patients do have Medicare, and so to obtain enteral nutrition through your Medicare benefit, there are some specifics that we'll talk about. Another thing, though, that I like to review, and some patients elect to get a feeding tube simply because they can get relief from aerophagia, which is the swallowing of air, which may happen as you are on non-invasive ventilation, a Trilogy, or whatever type of device you have providing that ventilation. In addition to those pressures stenting your lungs open and helping you, it's actually like a nap for your lungs. So I like that. It saves calories for patients that have that are using that. So I'm as interested in our pals having good compliance with their respiratory therapy as much as I am eating well, because they work hand in hand. But that air that can get into your stomach, that if you're not able to burp, then it travels through your bowel. Where with the feeding tube, you can actually vent the tube before it has to go all the way through your bowel. So it keeps you from being bloated. And so that's something else that we can talk about. Again, hydration is important, and you can't emphasize more how the fluid intake impacts that, but also immobility is something that impacts constipation and makes it worse. If you are having troubles with diarrhea, make sure that just because you have a feeding tube and swallow problems, that all the medications have not been switched over to a liquid form, because the base that they put those in are in those sugar alcohol bases. So if you have very many of those inputs and medications that are liquid, then you may have an increase in diarrhea. So we want to talk about that. Just the different types of, generally the initial tube is going to be the standard, as you see there on the left, with there's a little mushroom that helps keep it inside the stomach, and then there's a bolster there on the outside that can be adjusted when you regain your weight. And then looking at the replacement tubes, those are held in place by a little balloon that's inside the stomach that is filled with sterile water. The low profile tube you use with an extension set. So if the PAL is delivering their own feedings and has some dexterity challenges, there's a little more to do with the low profile in securing the extension set. But when it's not on, you'll see that it looks exactly like the third picture there that you see. For the low profile, and then there's various extension sets that you can put on there. Most of our patients don't have the one that threads through to the small bowel. This is a little more what it looks like, and again, you can see that you can see what the balloon looks like here, and then these are the close-up of the extension sets here. So again, this is kind of what the gravity bag feeding looks like versus the bolus. If you are using a bolus, I prefer that you don't use the plunger, but just let it go in to gravity. Is a good way to do that, and how to take care of it. So if you have an airway clearance vest, which many of our bulbar patients might still have those, then you can get a padding from the vest company so that it doesn't cause you to have problems with your feeding tube site. You also want to make sure that you protect your tube from gate belt or traction by turning in the covers. You don't want to get that tube pulled. And then we can get that loosened. This is something that I recommend, and again, I have no affiliation with the As Seen on TV trendy tops, and I don't know that they're part of that group anymore, but you can get these on Amazon or some of the websites. But the trendy top is something, they come in like small through extra large, and you can actually put the tube inside that, because I really don't like it when patients are showing me their tube and they're keeping it in their underwear, because that's where their food goes. So, ugh. So anyway, I like something like this, and I also like that it's not a medical item. They come 2 in a box, red, white, and black, and you can wash them. So anyway, that's just something that you might want to find. You probably don't find them online as much because it says they're perfect for low-rise pants, but mom jeans are back. So anyway, that's going away. But and then I have some instructions here for use in care, how to keep the tubes from getting clogged and how to keep the sites in good shape. And how to manage that. We've already talked a little bit about this, although I do want to reiterate that if you do have a tube feeding, if you are getting your meal in 5 minutes, then I would expect that you would have diarrhea. So that's one of the things that the gravity bag delivery system helps you to tolerate the feedings. Feeding too fast is like a surefire way to cause diarrhea and some like diaphoresis, sweating, and kind of like overall misery with your feedings. And those are those products that are in the sugar, alcohol, that are in those liquid medications that can cause that, like we talked about. And again, if the rate of infusion is too fast, then think about slowing that rate and using the gravity bags. And then sometimes we'll use a pump, maybe for a night feeds or continuous feeds if our PALs are not going out. So the practice parameters of the Academy of Neurology did establish that non-invasive ventilation and PEG feedings are complementary therapies. And like I said, it does spare you from those calories from that work of breathing and gives you that nap for your respiratory system. But again, if you are having air in your bowels from that, I have instructions on how to vent the feeding tube that I can provide for you as well. So we generally add the venting of the PEG to our home nursing orders. And then there's various things that you can do also to help eliminate that gas, knees to belly. A manual venting, there's also a device that can continuously vent if you're on continuous NIV, and a feeding, or that you can use this gastric decompression valve bag that you see pictured there, and you can use that with any type of feeding, bolus, gravity, or a pump. How do you get this paid for? So many of our insurance companies have this as a policy exclusion. So for example, Blue Cross Blue Shield did not buy your food before you got a feeding tube, so they are not going to buy it after. They may cover the supplies, but they may not cover the formula. And then also, if Medicare is covering your formula, there's a minimum amount that you have to use. So obviously when you're getting started, you may not be at this amount, but over time they're looking for you to have this minimum amount. And then they only cover for various diagnoses that are related to the GI tract. Dysphagia, swallowing difficulty, is a qualified diagnosis, but not failure to thrive, or if you've lost weight from your increased work of breathing. All of those things don't count. It has to be something specifically to that impacts getting food from the mouth to the small intestine. So those are some of the things that we look at in getting you your formula for home. And then if you have VA benefits, then it doesn't matter if your problem is respiratory related, you can get the product that way. So many of our patients utilize their VA benefits. Here's some options if for patients that are uninsured or don't have the coverage. I will say, I think Blue Cross Blue Shield Federal might cover the formula and certain various ones, but a lot of them don't. The patient assistance programs, most of the major formula companies make them, but by this time in the year, their funds have pretty much been depleted. A lot of our families may also look at ordering from the manufacturer or from on the internet. And I will say, if Medicare, if all the criteria are met, Medicare pays 80% of the charges. If you have a secondary, it would likely pick up and cover for the 100%, but you may have an out-of-pocket of 20% for your tube feeding. This is a little bit of information where you can get information about the Oli Foundation, the Equipment Exchange. I wrote an article for them in their Lifeline publication that talks about how to do home blended tube feedings for people that want to do that. And I am saying there is a renaissance of blended tube feedings commercially available, as well as those that are people that are blending them. I do also let folks know that being a caregiver for someone with ALS is a lot, and it's okay to use formulas. Some families like to do this, and if that's the case, I've provided some resources here on blended feedings for you as well. I thought I had on here, I also authored the Living with ALS booklet, the nutrition part of it. If you have access to those documents, that has more information there for you. But I want to really thank you all for having me present today, and I'd love to hear if you have any more questions.
Thank you so much, Karen. If you have any questions, please feel free to type them in the chat box right now, and we'll read them out.
I'm also going to put my contact information there. That's my email. If you want to contact me, be happy to respond.
We'll give everyone just a couple more minutes in case there's any questions. Here's one from Diana. How may we obtain handouts of some slides? Diana, we can probably send this out afterwards. Karen?
Um, yes, but for it to be large, if you want to shoot me something and let me know specifically what you would like, some of these I have like as a PDF that you could read it and not just see it on.
Yeah.
Yeah,
Yeah,
so I could
Karen, we
send
can
it.
absolutely, if you send us those documents, we could absolutely send them in our follow-up email along with the
Okay.
recording, so you guys can have those supplemental documents along with the recording of this presentation.
If you might want to specifically let me know which ones that you want.
Okay. Sounds good. Diana, let us know if there's specific ones that you're looking for. In the meantime, Linda has a question regarding supplements. What do you recommend?
I have several that I recommend. Are you talking about caloric supplements or caloric
Linda, I'll
supplements?
have you.
Let's see.
She said no, not caloric.
Okay. Okay. The evidence base doesn't specifically indicate that there's anything that we should be saying, everybody should be taking this. The B vitamins are a part of nerve nutrition. So like if anything, a B complex is probably not a bad idea. Almost everybody should probably be getting some vitamin D as well. And that's something like, even if you have a tube feeding, I know my vitamin D is like a little tiny gel that you could just open it and squirt it in the tube in with water. So that's a way that you could do that too. But those are the ones that I'm thinking about. I'm not really, I don't think that there is strong evidence on other nutritional supplements.
Okay. Tanya asks, should high acidic foods be avoided? Does that matter, i.e. apple cider vinegar, garlic, and tomatoes?
Not necessarily. Only like if there was like an indigestion, like GERD or something like that. But it's interesting, the whole acid base and people trying to get their body more alkaline, because it doesn't even really make sense where a lemon is acidic, but it has an alkalizing effect on the body. So I have a little bit of a disconnect with people that are, manipulating all of those things, trying to get all their pHs in balance. And we are designed with a very specific pH anyway, and it's only livable within a small range, and our bodies do a really good job at maintaining the pH that it's designed for. So the things that impact that are your breathing, your CO2, you're getting rid of your CO2, your stomach acidity, the hydrochloric acid can change to do what your body needs. And then your kidneys function like you're cleaning out the car. You take everything out of the car and you put back what you need. That's what your kidneys are reading, that last point of maintaining your pH. So I wouldn't stress over so much if you like tomato sauces or want to make something that's acidic. It's not something that I would discourage.
Great. Jennifer asks, can you suggest caloric supplements that are low volume?
Yes, I can. I actually have those in my little smart sets that I pop into a lot of people's patient instructions. So I have that as something ready to go. But things that you can get on the internet, one of my favorites is called Boost VHC, which stands for very high calorie. It's made by Nestle, so it tastes good. It's like 565 calories in 8 ounces. There's also Ensure Compact that is 4 ounces and 240 calories. That's pretty good. And then Benacalorie is one that is, it's in like a little bit more than a shot glass. It's 1.5 ounces in like a creamer pull top with a foil top on it. You can add that to foods. That has 330 calories and 7 grams of protein. So anyway, that's something that you can find online. and utilize that. Of course, you know, Freddy's Frozen Custard and a Dairy Queen Blizzard are very high calorie too. So it doesn't have to be something that is you know, that is a purchased as a nutritional supplement. And I will also say, people are always asking me about protein shakes, this and that. And what I like to emphasize, that calories trump protein. If you're not getting enough calories, then protein is chemically changed to do the work of calories. And we have a reservoir in our bodies for fat storage in our fat cells, of course, and then we have our carbohydrate storage as glycogen in our liver and in our muscles. Well, the only storage that we have of protein is muscles and organs. So we have to get enough of the protein-sparing nutrition so that protein can do its job that we take in. Most people get enough protein, but if they're not getting enough calories, then they're still going to have more wasting. I'm not saying that you're not going to have some wasting with this disease, but just to optimize it, that's just a little extra bonus there.
Linda asks, you mentioned medical cannabis. What is that recommended for?
Well, I think it's being used for pain, for assistance with insomnia. And then I just asked to have it added to what a patient was getting, because they're like, food doesn't taste good. I'm like, well, you're losing weight. We gotta. And so I asked about having that added for that side effect of appetite stimulus.
And then Nicolin asks, I apologize if I mispronounced your name. What are the big things to watch out for if interested in home cooked tube feeding formulas? We were basically told, no, don't do it under any circumstances by nurses when the tube was placed.
Okay, well, I would encourage you to go to my Lifeline on the Oli Foundation and look up, search for my name and look that article up. Or I could actually send that to what we're talking about. It's not an either or thing. Like, if you want to incorporate some foods, but you need to maintain excellent hygiene, of course, when you're cooking, and if it's something that you're making it by the batch, you know, store it properly. Sometimes you freezing it and then pulling it out as you need it, but just excellent. And I've got several articles. I've got a another article on the renaissance of blenderized feeding that I wrote for the for a journal, but I do think it's something that I don't pull it off the table, because what, food in the stomach of all the horrors? No, that's fine. You know, and if someone wants to flush with some cranberry juice, or have, I have a friend that's a dietitian, and she has in her advanced directives that if she has a tube feeding, that she is to have a 5-ounce pour of a good red wine every night, you know. So those things are okay, and I'm not looking to change things that people enjoy in their life. So if you want to provide that, I would say that's something that you can explore. Definitely.
Diana says, super informative. Thank you very much.
Thank you.
And Tanya asks, do you recommend the medical cannabis to be ingested?
You know, I can't really speak to that. I'm a dietitian, and I was just looking for, I know they shouldn't smoke it with the respiratory challenges that they have. They don't need to be smoking it, but I'm not, the medical cannabis, I'm not sure even how that comes. I just saw that it was being provided. I don't know if it's coming in a pill or what, or, you know, if you can make brownies out of it. I'm not really sure, but just check with your physician and just forget that I ever mentioned it on this video.
Linda says, great presentation, very informative. Thank you.